Imagine spending more than a decade of your life preparing for a career. Missing holidays, missing birthdays, taking on hundreds of thousands of dollars in debt, sacrificing your 20s, your 30s, your youth, your family, and sometimes even your health, only to reach the finish line and discover that the profession you've spent years chasing is no longer what you thought it would be. Across the country, physicians are leaving medicine. Some are retiring early, some are walking away completely. Some are finding different paths and careers. Some are reducing their clinical hours, and others are quietly planning their exit. The question is, why? And perhaps even more importantly, what does it mean for patients? My name is Dr. Aisha Rush, and welcome to episode 5 of Informed and Unfiltered, where we discuss the truth about medicine, the good, the bad, and the ugly. Medicine was once a calling. For generations, medicine was viewed as one of the most respected professions in society. People entered medicine because they wanted to heal. They wanted to help. They wanted to make a difference. Most physicians did not choose medicine because they expected to become wealthy. They chose medicine because it felt meaningful, because it felt purposeful, because it aligned with their values. Yet somewhere along the way, many physicians began to feel disconnected from that purpose. But why? There doesn't seem to be one distinct answer, but I can try to explain from my perspective. Becoming a doctor is not about how much money you're going to make. If people really knew just how much of our money goes to the loans that accrue never-ending interest, it would blow their minds. This is not to mention the fact that things like our disability insurance can cost $1,700 a month. This is more than many people's mortgages. We simply have a bigger price tag for things many people pay reasonable prices for. So, for the money we make, be rest assured that we're paying it out on goods and services at prices most people couldn't fathom. Many doctors live their lives just like everyone else in the world. We come home, we try to make a meal, we try to spend time with our families, we try to simply rest, have peace. We're not going on extra elaborate vacations. We oftentimes don't even have time to take vacation. We barely have time to go to our children's school plays. The most valuable thing we spend our money on is time, trying to buy it back in whatever way we can. This time that we try to buy back most often is time for us to just sleep, rest, and maybe enjoy some family time. Now, don't get me wrong. There are those few out there, meaning those few physicians, that post the pictures on social media trying to show everyone how glamorous their lives are. What many don't know is that some of those pictures are just the last hurrah before the divorce, before the custody battle, before lives are upended or destroyed. Or those pictures are a ruse for what is really going on behind closed doors, because our lives as physicians don't always allow for the regular things everyone else gets to do. Many of us spend more time at work than we spend at home. We have to schedule children's birthdays. We have to schedule time with our mates. We have to schedule months in advance to spend time with friends. Our schedules are tight and our brains are even tighter with all the responsibilities we face in this business and in our personal lives. One of the biggest reasons doctors leave medicine is simply disappointment. This is the greatest betrayal. Not disappointment with patients per se, although there are times when some patients make it difficult for us to enjoy what we do, but rather disappointment with the system. Most physicians entered medicine expecting to spend their days caring for people. Instead, they often find themselves spending enormous amounts of time documenting, clicking boxes, responding to messages, obtaining prior authorizations, dealing with insurance companies, meeting productivity metrics, dealing with hospital politics, trying to protect our careers, and practicing defensive medicine because of the fear of being sued. And believe me, this is just to name a very small few things. Many physicians feel they have become data entry specialists who occasionally practice medicine. Some physicians feel like they are conflict resolution specialists that have to navigate difficult and often broken healthcare systems. Some physicians feel the more they try to advocate for themselves and their patients, they become more of a thorn in the hospital administration's side and ultimately become a target. Essentially, the profession they train for is often not the profession they're actually doing and definitely not the one they signed up for. Doctors increasingly feel like they have less control than ever before. We feel the loss of autonomy daily, and it's evaporating quickly. Think about that. The individual with the most training and expertise is often the person with the least authority. Insurance companies can deny treatment. Hospital administrators can dictate workflows, despite the doctor knowing what's actually needed to make things work better and flow with more ease. Productivity targets influence clinical decisions. Electronic medical records influence how physicians spend their time. Many physicians feel they are no longer practicing medicine. They are practicing within a system that tells them how medicine should be practiced. And that loss of autonomy is devastating, and not to mention overwhelming. So, how do we get here? The people who trained for years upon years, now taking orders and directions from people in suits who have never stepped foot in an exam room, who have never seen a patient, who could have the faintest clue of what it takes to care for a patient and definitely not diagnose or treat a simple ear infection. But yet, they're running the show and driving more and more doctors out of the business at a time when medicine needs us most. A time when there is such a shortage of physicians that patients have to travel hours to see a specialist or to get an ultrasound or to even see a doctor, not even just a specialist. So now, the idea of burnout and moral injury is one of the most important discussions in medicine today. For years, we have talked about physician burnout, but many physicians reject this term. Burnout implies the problem is the physician, that the physician needs more resilience, more yoga, more mindfulness, more wellness seminars. But when exactly do we have time for that when we don't even have time to sleep, rest, or even spend time with our children or spouses? Some of us can't even think about time for ourselves when we have other responsibilities like family. We're already trying to make up for lost time with our families. So many doctors often feel guilty or selfish if they take time for themselves. God knows I did and still do. But what if the physician isn't the problem? What if the system is the problem? That is where the concept of moral injury comes in. Moral injury occurs when people are repeatedly forced to act in ways that conflict with their values. Many physicians know what their patients need, yet barriers prevent them from providing it. That creates frustration, helplessness, and eventually despair. It creates a cognitive dissonance that can at times be paralyzing. One of the worst things in this business is knowing what's right and what needs to be done, but being denied the tools and support to provide it. So let's talk about the cost no one talks about. The public often sees physicians as successful, grounded, in control. But few people discuss the sacrifices that many of us have made to get to this point, such as missed family events, missed holidays, long nights, long weekends, sleep deprivation, relationship strain, mental health struggles, physical health struggles, and as previously mentioned, in some cases, divorce. Some of us face strained relationships with our children because we weren't around to see them grow. Talk with them about their first menstrual cycle, help them through tough times at school, or even be there to help them with their homework. And let's not mention the many nights we weren't there to tuck our children into bed at night. The long 24 and 48-hour calls on nights when your child has a nightmare, but mom or dad is not home to help them through that fear. Many physicians eventually ask themselves a difficult question. Was it or is it worth it? For some, the answer remains yes. For others, the answer becomes increasingly unclear and extremely uncomfortable. Women physicians are asking different questions. As a wife, a mother, as a physician, I have thought about this deeply. For years, I have practiced as an OBGYN first, and everything else came second to that. Everything in my life, including my husband and children, were planned around my job. They simply came second. At times, there was no room for them as I strived to build my career. At one point in residency, rather than encouraging the family structure and making sure I tried to balance life equally, I had one of my attendings tell me that I did much better on rotations when my husband and children were gone. This attending made this statement when I was going through a very difficult time in my life, and she knew that. I actually reached out to her in an effort to have some support. It was everything but that in terms of my relationship with this attending. When I started my residency, my husband and I moved to another state and moved away from our home base for the first time. My husband and I were alone with 4 small children and no family to help. That was a sacrifice that we had to make. Sometimes you don't really choose your residency. You rank them, you hope you go to where you want to go, but that doesn't necessarily mean that you're going to go where you need to go that makes sense for your family. When I went to residency, my husband had a difficult time finding a job and eventually had to return back to our home state to go back to his old job to help support our family financially. Because we had a slight semblance of support back home in our home state, he had to take the children with him. I definitely didn't have the income or support to keep our children with me. That was devastating. I was alone. My husband and children were gone, and all I was left with was a decision I made to make medicine my career and a residency that was less than supportive. I told myself, this is what it takes. You have to do this to make it. But I was severely conflicted and just simply sad. I'd never really felt what depression truly was, but back then, I thought for the first time I felt it. I asked myself if I was making the right choice, the right decision. What good was a career if you lost your family in the process? We simply just had to weather the storm. So my husband would travel 6 hours back and forth each weekend from state to state just to see his wife and bring our children to see their mother. It was a difficult life back then, and one I didn't know if my children, myself, my husband, and my marriage would survive. You would think that my attending would recognize the struggle and be sympathetic or even empathetic to it. Rather, this particular attending embraced my unhappiness, rubbed it in my face as if it were part of the hazing process that medicine often lends itself to. It was awful, but I'm here today. I'm grateful for an understanding and resilient husband. Most of all, I'm grateful that my children have given me such grace that I can only thank God for. I am also sincerely grateful for their sincere resilience and their love and their continued support as I continue to navigate this thing called medicine. After such a tumultuous journey in this process of becoming a physician and building my career, today, my perspective is very different. I had to make a tremendous effort to make it different. My family now comes first. Medicine has to fit into that reality, not the other way around. Many women physicians are asking similar questions. What does success really mean? And what will that success cost? Is success a title, a salary, a position, or is success having a life that reflects your values? Those are very different questions. So now let's delve into the physician shortage nobody wants to talk about. When physicians leave medicine, patients feel the impact. Longer wait times, reduced access, fewer specialists, delayed care, or even worse, no access to care at all. In some rural and urban communities, trying to recruit a physician is all but impossible. Many people like to be near metropolitan areas due to the access these areas provide. It often takes a special person committed to their profession and patient care to choose communities that are either rural or urban. I started in rural medicine, and believe me, it definitely came with its challenges when it comes to patients' access to care. Patients would have to travel hours to see a specialist. Because I came from cities like Detroit and New York, I had never heard of such a thing, but it exists. Losing physicians makes this all but worse. The physician workforce is aging. Many doctors are retiring. Fewer people are choosing certain specialties, and increasing numbers of physicians are reducing their hours. Some physicians are just leaving the profession because they've reached their point of saying, it's just not worth it. This kind of thought goes back to the Bible verse, Matthew 16:26, that says, "For what is a man profited if he shall gain the whole world and lose his soul?" This is not just a physician problem. It's a healthcare problem. And ultimately, it becomes a patient problem. So why do some doctors stay? Despite everything, many physicians remain committed. Why? Because patients matter. Because medicine still matters. Because there are moments that remind physicians why they chose this profession in the first place. The baby that takes its first breath. The cancer patient who beats the odds. The patient who says thank you. Though that's becoming rarer and rarer these days, we do cherish those moments when we do get a thank you. Those moments still matter. And for many physicians, they are enough. There are those physicians who stay because they feel stuck, though. They have no desire to pick up and start a whole new venture or career. There are some that feel medicine is their identity, and without medicine, they have no identity. There are some who stay because they simply know nothing else. But there are also some who stay for all the wrong reasons. Those ones who stay for the wrong reasons sometimes become disruptive physicians and simply make other people's lives miserable. I know a few of those physicians myself. But for the most part, it's almost impossible to stay if you don't truly care. And most stay for all the right reasons. And medicine and our patients is where many of our hearts lie. So, doctors are not leaving medicine because they're weak. They're leaving because many no longer recognize the profession they once loved, the profession they signed up for. If we want to keep talented physicians in healthcare, we have to stop asking how to make doctors more resilient and start asking how to build a system worthy of their dedication. The future of medicine depends on it, and so do our patients. I'm Dr. Aisha Rush, and this is Informed and Unfiltered. Thank you for listening. Please like and subscribe on our YouTube channel. You can also find us on Apple Podcasts, Spotify, Buzzsprout, iHeartRadio, and Amazon Music. You can also find specific obstetrics and gynecology topics on my personal YouTube channel under Dr. Aisha Rush. See you next time, where we will be discussing yet another compelling topic. See you all later.